Hello and welcome to my channel. My name is Peter Abraham. I'm a registered nurse with experience in cardiology, med-surg, long-term care, and extensively in hospice. And normally I publish videos on Wednesdays and Fridays, so this is a special broadcast for lack of better words. If you're new here, welcome. We talk about a variety of nursing-related topics, anticipatory grief, book publishing, events happening in the hospice world, holistic nursing, dealing with chronic illnesses that often turn into terminal illnesses, and we go from there. If you like what you're seeing, if you want to comment, please do. And part of the reason, by the way, in terms of talking about comments, that we're having an episode today versus waiting until Wednesday is one of the new subscribers is looking for a video dealing with end-of-life doulas, and I'm going to actually be researching that on Monday for publication on this coming Wednesday. So I just wanted to provide an update today about a book that's already available in Kindle format as of now and will be available in paperback and hardcover either very late this evening or early tomorrow morning, and that's called Hope in Action. Now, before I go much further, what I like to do in every episode, and I encourage you to please do the same, participate with me, is what are you grateful for? So even like if you're watching this, that means you have internet. That means you have a device that you could watch videos. You have something to be grateful for. I'm not saying grateful to see my face or what I'm sharing, but find things that you're grateful for and acknowledge them. So some from Friday, the last episode to today. I'm so grateful for those of you who have been buying and reading my books. So grateful for the person who commented about end-of-life doulas, because I've been actually looking into that. For better or worse, sometimes I suffer from analysis through paralysis because I could overanalyze things. If you're guilty of that, I'm raising both hands. So I've been researching doula programs and the value of certification, especially since I am a hospice nurse. But I hope to provide something of value in that discussion come Wednesday. And I'm just grateful for a beautiful day here in Kentucky. My wife is ecstatic. Today is the first day since we moved to Kentucky. And I don't know how to say this because to me I find it a little bit hilarious, but we have a burn pit out in the backyard and she wants to burn. So I'm thinking, did I marry a pyromaniac? I'm kidding. But I'm grateful that she's getting her wish, that today's not too windy and the weather's cooperating, so she could burn some of the appropriate materials out back. And as you can see with my puppies, that if I'm not writing a book or reading a book or doing research, we were out back earlier today just watching my wife have fun with the burn pit. And yes, I roll around in the grass, the same grass that they pee and poop in. Yes, I've changed. Anyway, before I gross you out on that, but if you're a nurse, that may not gross you out. But I'd like to play a short clip briefly about walking you through the new book that's being published called Hope in Action. So last October, I published Hope in Practice. Now, this is how to implement hope. For those of you who are not aware, the Centers for Medicare that governs hospice in the United States of America, so it doesn't matter what insurance you have, doesn't matter how young or old you are, Medicare governs hospice in terms of the regulations. And for the longest period of time, we relied on what is referred to as the Hospice Item Set, or HIS, H-I-S. And those are assessments that are done on admission, on recertification, on death, with not too much happening in between, but with the hope tool that has to be in place. So October 1st, every hospice agency in the United States of America has to be operating with HOPE, no pun intended. And so HOPE is very structured. There's a HOPE admission visit. There's 2 HOPE update visits. There's special visits that have to occur at specific intervals. And then there's the discharge visit. So in this book that talks about how to implement it, it mentions about training staff on the various assessments. So I finished writing HOPE in Action, which is the book that teaches hospice nurses and clinical managers how to do the actual assessments. What are the timing? What are the triggers? And so let me walk you through the PDF version of the paperback. So these are the book covers of the HOPE in Practice and HOPE in Action books. Okay, I'd like to walk you through my latest book, HOPE in Action, A Practical Guide to Hospice Assessments. This book complements HOPE in Practice, which is meant to help hospice agencies implement HOPE, and HOPE in Action is dealing with the hospice assessments itself under the HOPE tool. So let me just walk you through. The introduction just goes over the purpose and the value of the book. Chapter 1 dealing with the understanding the HOPE assessments and the timely nature of those assessments. Who is involved in all of these assessments. What I've tried to do in this book, and I also did the same for the Hospice Conditions of Participation book, is include clinical examples whenever relevant, along with impact statements, compliance. At the end of every chapter, there's going to be discussion questions, practice scenarios, and oh my word, I cannot pronounce certain words. Socrates questions, just to help build understanding. Chapter 2 goes over the HOPE admission assessment, timing considerations, the required elements. Conflict resolution whenever possible. I'm not sure if you've ever heard of the DEEP framework. That's something I learned in my research for this book. Describe the problem, explore perspectives, evaluate options, and plan the next step. And again, with the conclusions, there's discussion questions, practice scenarios, Socratic questions. Chapter 3 deals with the update visits. There's 2 that are required within certain time frames. Chapter 4, the special focus visits, what triggers them, clinical scenarios, considerations, interdisciplinary coordination, which is extremely important. Caregiver communication is very vital. And one of the challenges, by the way, for book authors is what do I put on a page and watching the page break. Certain times page breaks are okay, and other times it just detracts from the reading experience. So I am trying to be conscious of that with the books I'm publishing. The discharge assessment, whether it be to death, revocation, transfers. Other HOPE visit types, including changes of condition, for example, recertifications as well. CMS compliance. It always matters in terms of trying to be audit-proof. Looking at effective communication. Advanced HOPE assessments such as rapidly declining patients and That could be challenging. Dealing with the cognitive impaired can be challenging. Cultural barriers. Developing competency in these assessments, including tools like checklists. And I know I'm speeding through a little bit, but don't take this the wrong way. There's the book that can be purchased, Kindle form again available. There's a number of appendices, including a quick reference guide, documentation checklists, system assessment decision trees, sample completed assessment, common CMS audit findings. We have the glossary, references, bio, and other books. I strongly believe hospice agencies can benefit by purchasing and utilizing both books, Hope in Practice for the implementation of Hope, and Hope in Action for training the staff on the various Hope tool assessments. Thank you, everyone, for watching today's episode. I do hope those of you who have been buying and reading the books that I've been writing and publishing on Amazon have been benefiting. I'm so grateful for your purchases. I'm grateful for your reading. I'm grateful for your input. I am still working on course material for doing online courses for helping hospice agencies implement Hope, do the assessments, just a different form from those who don't want to buy and read lots of pages, just to have it more digestible chunks. And if there is a book that you would like me to investigate writing, or maybe an article, for example, on March 24th, I'll be putting an article on Compassion Crossing on how a hospice agency was awarded several $100,000 to look at the gamification of bereavement. So how can gamification, and they went with Dungeons and Dragons, help deal with bereavement? And I do believe there's a place for that, especially when you're dealing with younger children and very young adults. So if you have any ideas for what you'd like me to write about, whether it be articles or books, or like the one person who commented, could I do a video on end-of-life doulas, which I'll be researching tomorrow, Monday, March 10th, 2025. Please comment down below. Thank you, and God bless.